Venous thromboembolism or VTE risk assessment is completed on JAC at this organisation, and it should either be done prior to admission if it's an elective admission, on admission or as soon as possible, and certainly before the end of the post-take ward round. To access a VTE assessment on a ward, when you first log on to JAC, you end up on the Monitoring and Assessment tab, and there's a list of jobs or actions that need to be completed, and VTE is one of those prompts. If you try to go ahead and prescribe something without completing the VTE, it takes you back, so make sure that you do this. You just click on that prompt, VTE assessment on admission, and it brings up the standard Department of Health risk assessment form. You'll see there's 3 steps. So the mobility assessment, so you state whether it's a surgical patient, medical patient, and if it's medical, whether they have reduced mobility. And then you record the thrombosis risk factors, and there's patient-related, admission-related listed here, and then the bleeding risk factors. Now, it's important if there are no risk factors that you tick the box that says no thrombosis risk factors or no bleeding risk factors, because when we're auditing it in the background, when we're reviewing the quality, this tells us that you've actively done the assessment and confirmed there's no risks, rather than a blank form that we don't know whether you have or you haven't. So please, if there are no risk factors, tick the no risk factors box. Then you can press save. Of course, if there are risk factors for thrombosis, don't forget to actually go ahead and prescribe the VTE prophylaxis, and the choice will depend on the patient, the type of admission and those kinds of things. So there are guidelines that you can refer to. Now, if you happen to be seeing a patient in the emergency department, or perhaps day surgery or pre-assessment where it's not designated as a mandatory area for VTE, that doesn't mean that you can't do a VTE assessment. You certainly can do, it's just that it won't force you to do one. So if you're in that situation, you're seeing a patient, for example, in the emergency department, but they're going to be admitted, to get the VTE assessment, all you need to do is click Add Assessment, and then you'll see the options for the VTE assessments there. This is also the process that you would do if you want to update the VTE assessment. So if the clinical picture changes and you want to do a VTE assessment again to reflect that, that's exactly the same process, and then you would select, and then you'd get to the same form as before.